Years of budget cuts and staff loss are taking a toll on state and local health officials as they respond to the spread of the coronavirus.
So we know that we're trying to do more with fewer dollars and fewer people, and yet the challenges seem, bigger and bigger, especially when you look at something like a pandemic.
Your local health department is the health watchdog in your city, town, and state, and they're the ones that are tracking and identifying health hazards like a virus. State and local health budgets were hit hard by the Great Recession of 2008, but when the economy recovered, public health funding didn't. 49 states cut public health funding at least once in the 5 years after the recession started, and most states cut funding multiple times. And federal dollars given to state and local health departments through the Public Health Emergency Preparedness Program has decreased from $940 million in 2003 to $675 million today.
So often the local health departments really feel it the most strongly. And of course, local health departments are on the front lines.
The cuts are most noticeable in staffing, and that's exactly what is needed right now in order to quickly respond to the coronavirus. Things like extra hands to get people tested.
So there's a health department that is in Colorado, and they don't really have that many permanent residents, but they have tons of vacationers, skiers, international visitors. And so their health department's only 7 or 8 people, and yet they already have a ton of cases. And so they've had to say, we don't have the resources to do testing, for example, because we really need all hands on deck towards this response for people who are more sick.
60,000 state and local health jobs have been lost around the country since 2008, and about 50,000 of them have been local health workers. Fewer workers and the spread of the coronavirus means other public health issues aren't getting addressed.
But we have hepatitis A outbreaks across the country that people aren't really talking about, and those are the types of things that continue even while we're working on coronavirus.
Earlier this month, President Trump authorized an $8.3 billion spending bill in response to the coronavirus, and $950 million of that will go to state and local health services across the country. By the time the funds are dispersed, it may not be enough in the rapidly changing situation, a short-term fix for a longer-term problem.
So we expect that was a really important down payment, but we'll likely have to come back to that because the cost of this response is just astronomical, and it really is reaching every corner of the country. And we've had health departments who say to us, we can't look at the cost. We need to make the right choice for public health, and we'll figure it out later because we want to save people's lives.